We are in an extraordinary place. Roswell Park Cancer Institute and its predecessor, the New York State Cancer Laboratory, gave the nation and the world cancer research. It was being done here before it was anywhere else. And the first historically documented example of public funding for cancer research was in the late 19th century when Dr. Roswell Park and the publisher of the Buffalo Evening News at the time, Edward Butler, went to Albany, and they got a whopping $25,000 to finance cancer research. But so many breakthroughs have occurred right here. The PSH test, chemotherapy was invented here in 1904 and exported not only throughout the United States but throughout the world. The critical link to smoking and cancer. One of two men will be diagnosed with invasive cancer in their lifetime, 1 in 3 women. And the reason it's higher for men is because men smoke more. But this research is critical. And during the 1990s, there was a robust funding of federal research, the National Institutes of Health and the National Cancer Institute. A lot more promising new research that led to the development of new therapies were funded back then. And that's stopped. There's been a decline in funding when you take into consideration medical inflation. And the problem with that is not only do you lose promising new research, promising new therapies. They're looking at vaccines now, not just for prevention, but to boost the body's immune system to naturally fight cancer. The introduction of smart drugs in the last decade and all the new breakthroughs are fundamentally important to increasing not only the survivor rate of cancer patients, but the life quality as well. So I often say, the only failure in cancer research is when you quit or you're forced to quit, because promising new researchers leave the field. 15 years ago, about 30% of those applications in the National Cancer Institute for promising new clinical trials to test new therapies were funded. Now it's down to about 8%. So we're falling behind. So I wanted to come here today to tell you that I'm introducing the Cancer Drug Parity Act, which removes the disparity that currently exists, how the insurance companies treat cancer therapies. In other words, if you receive a traditional chemotherapy through the vein, an injectable, it's covered under the medical benefit. If you are on some smart drug, like Herceptin or Gleevec, and you administer it orally, it's treated as a drug benefit. And the consequence of that is a great disparity. And a lot of people can't afford prescriptions to begin with. But when we have this science that has given us these great breakthroughs and the insurance paradigm doesn't keep pace with the science, what good is the science if you can't access the great breakthroughs that are made? So this is a very, very important piece of legislation. 21 states have adopted it, but I think we need it at a national level. And we will continue to fight this because it's the right fight for the right people and for the right cause. I want to thank Dr. Donald Trump, Skip Trump, the Chief Executive and CEO Chief Executive and President here at Roswell Park Cancer Institute, for the great work that he has done and the great work that he will continue to do for cancer patients and their families. This is a very welcoming place, a very warm place, and it's a direct result of the leadership and their commitment to the extraordinary work that goes on here with clinicians and researchers and academics. So I want other people to speak to this issue because I think it's very, very important. There are a lot of components to it, but just keep in mind, cancer drugs, when they become available, when they show great promise to increase survival rates and life quality, they should be available to everybody. And the insurance paradigm needs to get caught up to the science. And so first we have Nancy Hales. Nancy is the Executive Director for the Western New York and Central New York chapter of the Leukemia and Lymphoma Society. Nancy?
Thank you.
You're welcome. Thank you.
Thank you so much. As the Executive Director of the Western and Central New York chapter of the Leukemia and Lymphoma Society, we'd like to thank Congressman Higgins for all that he has done for all of our constituents. He's always been a strong advocate. Because blood cancer cannot be prevented or detected early, the Leukemia and Lymphoma Society is focused on finding cures and ensuring access to quality, affordable, coordinated care. Since our founding 60 years ago, LLS has invested nearly $1 billion into research for cures, including over $124 million to funding of research projects in the state of New York. We're committed to ensuring that the most innovative therapies are able to get from bench to bedside so that all our patients can live longer, better, and healthier lives. Effective cancer treatment protocols utilize a complex and extensive set of health care services, including chemotherapy and prescription drugs, among others. LLS is dedicated to ensuring access to and compliance with the most appropriate evidence-based treatments for all blood cancer patients. I would like to specifically thank Congressman Higgins for introducing H.R. 1801, the Cancer Drug Coverage Parity Act. This bill is an important step towards improving access to needed life-saving cancer therapies. Thankfully, the New York State Assembly passed a similar state law in early 2012, which covers about half of all cancer patients in the state. We are hopeful that when this bill is passed, it will level the playing field to ensure access to necessary treatments for all of those in need. On behalf of the 1 million patients living with or in remission from blood cancer, thank you, Congressman Higgins, for your efforts on this bill.
Thank you, Nancy. Thank you very much.
Thank
you
you.
for being here. Thank you. And also we have from the International Myeloma Foundation, speaking on behalf of Patient Equal Access Coalition, is Megan Busby, all the way from Baltimore. Megan, it's all yours, kid.
Thank you. Good afternoon. As the Congressman said, my name is Megan Busby, and I am the Director of U.S. Advocacy for the International Myeloma Foundation, which is the oldest and largest foundation dedicated to multiple myeloma patients while working towards prevention and a cure. And I am here today as the leading member of the Patients Equal Access Coalition to strongly support H.R. 1801, the Cancer Drug Coverage Parity Act. This bill will require health insurance plans that currently cover cancer treatments to provide coverage for patient-administered anti-cancer medications, such as orally taken medications, the same as they cover intravenous anti-cancer medications. And I'm joined here today by other members of the Patients Equal Access Coalition, Roswell Park Cancer Institute, the Leukemia and Lymphoma Society, and the Ovarian Cancer National Alliance. Together, along with 21 other groups representing patients, healthcare professionals, care centers, and industry, we work collaboratively to ensure that cancer patients have equality of access to all approved anti-cancer regimens. PEAK believes that every cancer patient should have parity in insurance coverage for all cancer treatments based on the therapeutic benefit rather than on how the drug is administered. Every day we hear stories from our patients that can't afford the treatment that has been recommended to them by their physician because of high out-of-pocket costs. We've heard stories of people that have had to sell their homes or other belongings just to try to afford this treatment. And while many others, they've stopped taking their treatment altogether because they can't endure the financial burden. And as you know, cancer patients have enough on their plate as it is, and we just feel they shouldn't have to deal with worrying about the finances of their treatment in addition to all of the other things that go along with being a cancer patient. The Patients Equal Access Coalition extends its sincere gratitude to Representative Brian Higgins for his great leadership on this issue and for introducing the Cancer Drug Coverage Parity Act. This important and much needed legislation will ensure that all cancer patients in the United States have equal access to all approved anti-cancer treatments. Therefore, we urge Congress to embrace this crucial and life-saving legislation and to act quickly. Together, we're one step closer to a tremendous victory for the cancer community.
Thank you. Great job. Thank you very much. Thank you. Next, I'd like to invite Dr. Eunice Wang to say a few words. Dr. Wang is a medical oncologist right here at Roswell Park Cancer Institute and is here representing the American Society for Hematology. Dr. Wang, good to have you. Thank you very much.
Thank you. I'd like to thank you, Representative Higgins, for inviting me here to speak about this issue. My name is Eunice Wang. I'm a medical oncologist who treats leukemia patients here at Roswell Park Cancer Center. I'm also a member of the American Society of Hematology, which is the world's largest professional society dedicated to the causes and treatment of blood cancers, including leukemias, lymphomas, and myelomas. What I'm here for today is to tell you about the tragic trade-off that my patients have to make on a daily basis between their physical well-being and their financial well-being. I'm also here to express my wholehearted support of Representative Higgins' bill. Just for background, I want to tell you about a cancer that I treat in my clinic. In 2001, there's a disease called chronic myeloid leukemia. Or CML. And patients who were diagnosed with CML about 12 years ago were uniformly told that they had a fatal illness with a lifespan of about 5 to 6 years, even with the best available treatments. Nowadays, given to advances in science and cancer research, I am able to assure my patients in my clinic that if they have a diagnosis of CML, they can live a relatively normal lifespan with very few symptoms, without fear of dying from complications of their disease or intensive chemotherapy, with only the benefit of taking 1 or 2 pills a day. Now, while new treatments like Gleevec have completely and dramatically revolutionized our treatment of blood cancers and cancer in general, they have not come without costs. And for many of my patients, there is a significant unrecognized side effect of this treatment, and that is the financial struggles that they have to go through. Unlike intravenous chemotherapy, which is completely covered by insurance companies, oral chemotherapy drugs are not treated the same. And so my patients have to shoulder a significant financial burden in order to afford their life-saving treatments. In an article published in Blood, which is the journal of the American Society of Hematology last week, 120 leukemia experts from all over the world, the US, Asia, South America, etc., wrote as a voice to demonstrate their concern about the incredibly high costs associated with cancer chemotherapy drugs like Gleevec. These costs of these drugs are not insignificant. The average cancer drug cost in this day and age is over $10,000 a month, and that totals over $100,000 a year for these patients. Cancer drug costs have doubled in the last decade and contribute an unprecedented amount to the overwhelming cost of healthcare in the United States in this day and age. Healthcare that currently makes up 18% of the U.S. gross domestic product. While the Cancer Drug Coverage Parity Act doesn't do anything to directly deal with these high drug costs, what it does do is offer relief for patients who have to take these drugs because they have these life-threatening disorders. It also offers insurance guarantee for the pharmaceutical companies as they continue to develop these groundbreaking targeted therapies, that the oral chemotherapy drugs that they're developing to save the lives of future generations of patients will also be covered by insurance. While patients don't know if they can afford drugs, I can tell you what they do. They don't take their drugs. They reduce the dose of their drugs. They don't show up for appointments. They skip doses of drugs, trying to make those drugs last longer because they can't afford the next prescription. Research suggests that up to 10 to 20% of patients in this country don't take their drugs because they can't afford it. And when you can't take a drug that's keeping you alive, that's a big issue. I see this struggle in my patients on a weekly basis in my clinic. In the last couple weeks, I've had to tell 2 individuals in my clinic that they have a new diagnosis of CML. I've had to tell them, you have a cancer, you have a life-threatening disease, there is treatment for you, and you can live a normal lifespan with these treatments. In this day and age, there are 6 drugs that we have developed for the treatment of CML in the last 12 years, 5 of which are oral chemotherapy pills. I also need to tell them that for the rest of their lives, 20, 30 years, they will need to take a drug that costs on average over $10,000 a month. By creating parity for oral drugs like Gleevec and allowing insurance companies to view oral chemotherapy drugs the same way that they view intravenous chemotherapy drugs is saving the lives of my patients. We cannot subject my patients and other patients to the pain and suffering and the high costs of shouldering that financial burden themselves. On behalf of my patients, on behalf of the members of the American Society of Hematology, I wholeheartedly pledge my support for the Cancer Drug Coverage Parity Act. I personally thank Representative Higgins for bringing this very important bill to Congress and reducing the costs and cares of cancer patients that I treat. Thank you very much.
Thank you, Doctor. Well said. Well done. Thank you very much. Thank you. And finally, we'll hear from Stephen Korn. Stephen, a two-time cancer survivor himself, will speak on behalf of his wife, Rosemary Korn, who is currently undergoing treatment for chronic myelogenous leukemia. Stephen Korn.
Thank you.
Good to see you, sir.
Thank you for inviting me to share my patient's perspective, and thank you, Congressman Higgins, for your work on this very important bill. I am here today on behalf of my wife, Rosemary, to share both her story and our family story on why this bill is so important to us and other patients. About 2.5 years ago, my wife went in for a regular routine doctor's visit and discovered some very drastic news that she had leukemia. We came here immediately to Roswell Park since I was already a patient, and follow-up tests confirmed the diagnosis of CML. Immediately, she was placed on an oral administered cancer treatment called Gleevec, chemotherapy, and was required to take this prescription pill a day for the rest of her life. Thankfully, her treatment is under control, but she continues to take the Gleevec pill. Access to this therapy has truly saved her life. We are confident that without this medicine, she would not survive. Patients who can't access and live without this only live a couple years without Gleevec. Thankfully, we were fortunate that under my past employer's insurance plan, the copay was $30 a month. Though we know there are many patients in New York who pay in excess of $10,000 a month for this bill, which creates tremendous access barriers, financial burdens, and forces, in fact, many families into bankruptcy. After COBRA ends, which is the end of this year in December, I have a choice to make. Do I continue to buy Gleevec or at the expense of $10,000 a month, or do I buy food? Though that will be a big decision, after which point, do I have options? Do we as a family have options? We are likely to purchase health care coverage under the New York State Exchange, which again, we thankfully see Congressman Higgins sponsoring that bill. Unfortunately, cancer has touched our family twice. I am both a survivor of non-Hodgkin's lymphoma, where I had CHOP and Rituxan injectable chemotherapy for 6 months, and also prostate cancer, which required surgery. It is because we've been able to have the access to life-saving therapy at the wonderful Roswell Park Cancer Institute that the both of us are alive today. Thank you again.
Nice job, Stephen. Thank you very much.
Thank you.
So the bottom line here is chemo parity will enable patients to have access to the best available treatments to extend and improve their lives. I'd like to thank again everybody for attending, and Roswell Park Cancer Institute again for graciously hosting.